Hi everyone, it's me again for the second part of my video assessment. My name is Alberto. I'm a family nurse practitioner student for Siemens University. Today I'm going to do three parts of this assessment: abdomen, musculoskeletal, and neurological. Let's start with the abdomen. For the abdomen, I have my patient lay down, right? And I'm going to inspect the contour, inspect the abdomen for the contour, the scar, check for the skin. So he has a shirt on, but I'm just simulating here. So I'm gonna pull a shirt and I'm gonna check for everything. And masses, and nodules or anything like that. So the next for the abdomen, I'm going to oxidate. So, and I'm gonna do the 4 quadrants. And to report if you have any hypo or hyper activity or normal activity. So in order to do this, we take around like 5 minutes each quadrant when you listen for the abdomen, okay? Just listen. For the next part of the abdomen, we going to do the palpation. In order to do the palpation, we do a light and a deep palpation. So, and then we're gonna palpate for tenderness and masses. Okay, let's see. That was the light, and then the deep palpation. They go really deep. And the deep palpation, when you do, don't forget to do the palpate the spleen, of course, and we can do also the percussion of the liver span. It should be 6 to 12 centimeters. Okay, so. And also the spleen. And don't forget to ask questions as do I have any pain? What do you feel when I touch here? That kind of thing. Okay. The next palpation is gonna be the aortic pulsation. That is right here in the middle. I need to feel it to see, feeling the aortic. I can also listen for the brewing of the aortic. Okay, so next one, in order to do this, I'm gonna ask my patient to sit up because it's gonna be the CVA tenderness rebound where I check his kidney. Luis, could you sit here, facing that way? So here is that one. Okay, like that. So, in order to do this, I'm going to the 12th, the last like rib cage right here, and I'm gonna put my hand and check, okay, with my fist like this, both sides. And when I do this, I ask the patient for tenderness or pain. That's gonna check the kidney. So can you face this way, please? Now, that's for the part for the abdomen. Now we're going forward for the musculoskeletal. Okay. Next thing that we do it is gonna be, we're gonna start from the top to the bottom. We start with the neck. For the neck, I need to inspect the neck to see if it doesn't have any swelling. Check for the, see if the lymph nodes is showing and thing. Because you have a beard, it's gonna be a little bit tricky, but we still can do it. After the inspection, we go into the palpation. So I I like to start with the back and I palpate. I like to palpate the lymph nodes again, like we did this before in the other video, but I like to redo once we're here, why not, right? I check for that too. And remember, once you checking the inspection, the palpation, we should do the range of motion as well, and the strength of all those musculoskeletal parts that we're doing right now. So for the neck, I'm gonna ask him, can you turn to the right, your head? No, your head, just the head. To the left, look at up, down, go back. Now I can check for the back, for the strength, and put some resistance and ask to the patient to turn the head to sides and left and right, so that way we can see the strength of the head. Turn to the right, right, left. Now try to bend your head like this. Okay, so he's fine. So we go, that's what I did. The same, we going down, we go to the shoulders. So for the shoulder, can you put your hands in the side? We need to check if the alignment, if it's like, if he's have any, some people have one shoulder up and down. You need to check this symmetry. That's the word, symmetry. And after inspect the symmetry, of course the patient's gonna have no shirt, so, but like it's cold here. And so I can touch to feel it, and the deltoid, this area as well. Always when you, after you inspect, you doing the palpation, always ask the patient for pain, if they feel any pain or any discomfort when you touch it. That's a very important part. And after you do the palpation, we go into the range of motion. So you can ask the patient to lift the arm, and always remember the abduction. The abduction you can always try it this way, okay? And lift the shoulder up and down, and for the extension we can do to the back, okay? And do you feel any pain?
No.
Yeah, remember, always ask for any pain or discomfort. This we always have to do bilaterally. So the same thing, you go to the side, to the front, up, and to the middle for the adduction and the extension of that, okay? So once we're doing this, we're going for down. Now we're going to the elbow. So same thing, we inspect the elbow, both of them. We do the palpation, just check for anything, both sides, and we do the range of motion. That's the flexion. Then there is no extension. This is basically the extension for elbow because you cannot do all the way, and adduction. Yeah. So again, both sides. For the time purpose, I cannot extend this much, okay? But always both. Next one, we're going down to the wrist. So again, inspection, right? And we're gonna try, we're gonna palpate the wrist, and we're gonna do like range of motion. Do this, in, out, up and just the wrist. Yeah. Once we did this, again, now I need to do the strength. So I can actually hold it and he tell him to press down, so I can test the strength of the. This is gonna be for everything. Again, because of the time of this video, I cannot explain this. Next one, we go to the fingers. Inspect the fingers, each one of them, and ask the patient to do a fist and open, spread and close, and you can check that's basically the hand of motion of each finger. The same for the other one. Next one we're gonna do, it's gonna be the hip. For the hip, I'm gonna ask the patient to stand up. Can you stand up? Let's move this quickly. So, for the hip, we're gonna see, I'm gonna expect the hip of the patient. I'm gonna touch to check if I have any pain. Again, I expect before, of course, I'm gonna look at his hips and all that. Now we're going to the range of motion. Can you put your leg to the side? That, yeah. And close the adduction and the extension for the ribs. You put your leg for the back. Can you put your leg back? Yeah. I mean, hold him. So, and to the front. Now for the extension. Yeah. So that's, we went for the hips. Now, next one, going down, you can sit down. We go to the knee. For the knee, we can do, we're gonna inspect the knee. We're going to palpate the knee, legs to legs. And we're going to do the range of motion. That's the extension and the adduction for the knee. And we can also test the strength for this. The next one, it's the ankle. So for the ankle, I'm going to oh, I don't think you can see in the video. I'm going to let's do this. Inspect it, palpate, and try the range of motion. He's gonna do like inward, do like this, outward, and down, up. Yeah. I'm trying to do my best. Let me see if I can fix this a little, just to see. I hope I can. Yes, I think it's much better now. Okay, so, and then test the strength as well. It's pretty much the musculoskeletal. Like, move forward, we go into the neurological last part. I'm gonna have to be a little fast in this one. So we're going to test like the cognitive functions of the patient. So we can do 2 tests to start it. So we can start like asking questions as do you have any headache and dizziness and numbness? So, and then we go to the cognitive, I'm already in video. Okay, for the cognitive part. So I can ask the patient where you are. Do you know that that's for the cognitive function? Do you know what the day of the year? The date of which years is this year? The date, the day of patient birthday, which country he lives in, which month we are. So, and I can also give 3 words for the patient to remember at the end of my neurological test. So let's say I say to him like ball, cat, and vacuum. So he needs to tell me these 3 words back at the end of the test. So I can tell the patient, could you remember two, three, I'm gonna give you three words and you need to give me back at the end of the test. You need to remember. It's gonna be ball, cat, and vacuum.
Ball,
Cat and vacuum,
cat, and
just
vacuum.
remember. Okay, so and then at the end of it, the next one is gonna be the high intellectual function. But normally, when people ask to count back, and that's a very, I think, 7 by 7 400 to zero backwards. I think this is very very hard, for be honest with you. So, but I can ask him to name stuff. Can you tell me what's the name of this?
That's
Yeah. Um, so I can also ask the patient to repeat words for me. Like, can you repeat this phrase? The sun is light.
the sun is light.
Okay. And I can ask the patient also to write a sentence or draw, use a piece of paper and say to the patient, could you please draw a clock? And they're gonna do it, and so, and it's pretty much like this. Yeah, that's just for the high function motivation. The next step is gonna be still in the neurological. I can test for the cranial nerves. So for the cranial nerves, we're gonna start with one. The one is olfactory. So it's the one responsible for the smell. So what I can do is like tell the patient to close his eyes. By now I'm not testing this, but close his eye and give something to the patient to smell and ask if he can smell. So that's the test for that. So the cranial nerve number two is the optic. The optic I can use actually the Snellen test. So I can put away from the patient and ask like, so, Tony to repeat for me and cover the eyes one at a time and do this test right here. Okay, the next cranial nerve number three, we normally do the three oculomotor with the number four, the trochlea, and the six, the abducens together. Why? Because I get a pen, right? I would do like, I would test for, of course, you're gonna be without glasses. I'm gonna do the light reflection, and one that you can test these three together is like do the H letter with your pen and tell the patient to follow the pen with this. So you do the H. So, and you do these three cranial nerves. The next one is the cranial nerve number five, the trigeminal. So the trigeminal, we can test like the jaw open. Can you open your jaw? Close. So that we can check. I'm sorry, I'm kind of rushing you. But that's the part of the test. So the other one is the facial, number seven. Number seven, the facial, I'm gonna ask him to smile, do a front face like this. You get your put your eyebrows up and down. Yeah, so that's when I check for the seven. The next one is the vestibular cochlea. So for these, I test for the hearing. So I cover one ear and I whisper a word in one ear and I ask him to repeat back to me, and I do in both sides. So that's as the number 8. Number 9 is, and 9 and 10 we normally do together as well. 9 is a glossopharyngeal and the 10 is a vagus. So what are you doing in this? We gonna check for the gag reflex, I'm gonna ask him to open his mouth and open your mouth, and I'm gonna check for the uvula in the back to see the movement of the uvula and his gag reflex when I do put this inside it to test like if he can swallow and all that. The next one we're gonna do is the 11th. The 11th is the spinal accessory. So that one is responsible in the shoulder. So you're gonna do like shoulder movement, shoulder up and down, and I've checked for the strength and the symmetry. The number 12 is the hypoglossal. The hypoglossal, it's I'm gonna ask him to open his mouth, put his tongue out, and move his tongue for both sides and up and down, and that's gonna be the 12 cranial nerves. The next part that I go for our test for the neurological is gonna be the reflex. The reflex, I'm going to do upper extremities and the lower extremity. So for the upper extremity, I'm gonna start with the biceps. So I'm gonna use this, and I'm gonna do like, I'm gonna try to, okay, I ask the patient to relax, and I put my finger here and I go and test for the reflex. So that's the biceps. I can do the same in the triceps in the back here, and try again. Both sides. And the brachioradialis, it's gonna be in this area right here to see the reflex. And again, I go and check. So for the lower extremities, I have the patella, that I'm gonna go in here to see the reflex. Yeah, actually has a reflex, and for both sides, and that's gonna be the patella. I can do also in the Achilles. That's gonna be the back here, and I can also test it with the hammer. And once I'm here, I can test the Babinski test that we go from the bottom to the top with this part of the hammer to test if we have a response. Can you see he actually do? You can see if it's positive or negative. It's depending if we go in order downwards. So the next we can do, it's the test for the lower extremity for the clonus. It's the dorsiflex and the plantar flex of the foot. So both foot up, please. I mean, just for you guys can see, can you do down, up and down, and hold a little bit just to feel the strength? Yeah, and he can do this. Continues like the cerebellar is the sensation of the, I'm gonna test for the sensation of the up and the lower extremity. And for this, I ask him to close the both eyes, and I get like dull and a sharp object that I can test him. And with his eyes closed, I can touch part of his body and ask him if he feels sharp or dull. And the patient's gonna repeat back to you. So the next one is cerebella. It's the coordination. So I'm gonna ask the patient to do finger to nose. Can you close your eyes and touch your nose with your finger, please? It's kind of hard for him. So anyways, and the next one that we go in, it's like the RAN. That's the rap alternate. You're gonna put your hands on your thigh and on your thighs right here, and then you're gonna do faster, up and down, faster. To test for the end. So, and now we can do the finger touch as well. Do this, touch one at a time. Okay. And for the last part of the cerebellum, we can do the gait with the tender walk. Can you stand up? And I need you to walk from there, from the sofa to where I am with one foot in front of the other. And that's pretty much our test. I hope you guys enjoy. Thank you.